Hello, my name is Frank McGowan. I'm a pediatric cardiac anesthesiologist at the Children's Hospital of Philadelphia. And I'm going to spend a few minutes talking about the current status of near-infrared spectroscopy monitoring in pediatric cardiac surgery patients. There's a real need to improve neurologic outcome in our patients, as currently approximately 20 to 80% of them have some form of neurologic injury. And we have not really improved this outcome very much, if at all, in the last 10 to 20 years. There's evidence of injury both in various imaging modalities as well as by various forms of neurodevelopmental testing. And these issues have become increasingly important as the overall survival of our patients improves, and hence their long-term outcomes and quality of life become much more the focus of ways that we can improve their care. This slide is representative of one of the types of validation studies that's been done in children and infants with congenital heart disease, comparing near-infrared spectroscopy values obtained with sensors placed on the forehead to the arterial-venous oxygen difference between arterial oxygen samples and jugular bulb venous oxygen saturation values. RSO2 are NIRS values, SaVO2 are the AVO2 difference values. As you can see in this study, about 89% of patients were ASA 3 or 4, so they had very relatively severe forms of congenital heart disease. 62% were cyanotic, and in about 17% of them, their room air saturation was under 80%. As you can see from the panels on the right-hand side of the slide, there's fairly tight correlation between the measured NIRS values and the calculated and measured AVO2 difference, both in terms of the correlation in the top panel and then Bland-Altman and root mean squared analyses in the bottom two figures on the right. It's important to point out here, however, that the number of patients with severely low NIRS values, under 50%, in this validation study and others like it are relatively small. This slide is typical of the kinds of retrospective cohort studies that have been done to assess the outcome of patients who have various NIRS values and neurodevelopmental outcome. This is a retrospective cohort study in 51 patients with hypoplastic left heart syndrome, only 21 of whom had neurodevelopmental testing, which was performed at an average of 56 months. This study, as along with many others like it, shows that there is some degree of correlation between various forms of neurodevelopmental performance, either overall performance or various subtests such as visual motor integration, with NIRS values that are in the range of 55% or lower. So a number of studies retrospectively have shown various levels of impaired neurocognitive performance if your NIRS value for some period of time, either in the intraoperative or postoperative period, drops below 45 to 55%. Similarly, there are a couple of retrospective studies that show evidence of new brain lesions by magnetic resonance imaging with values that are in the same range, again, under 50 to 55%. So in summary, it is clear that current NIRS devices, at least semi-quantitatively, can measure something that appears akin to oxygen supply-demand relationships under the sensor. There is, however, no Class 1 evidence to support the use of NIRS as a standard of care for pediatric cardiac surgery. Some wonder whether, at this point, given the widespread use and adoption of NIRS and the beginning of treatment algorithms to change NIRS values, whether a placebo-controlled blinded study is even possible at this point. In this regard, it may be useful to point out that pulse oximetry also lacks such evidence, and a recent Cochrane review in over 22,000 perioperative patients showed that there was no evidence that pulse oximetry alters anesthetic or perioperative outcomes. However, I doubt that we'd be willing to give up our pulse oximeters. Therefore, we probably need to continue to work to improve this technology, carefully assess and critically assess the changes that are prompted by it, and I think it still remains that well-designed pragmatic clinical trials are almost certainly needed in this field. Thank you very much.